Hey, thank you very much for considering us and accepting our plan to take you to surgery. So we have some preoperative instructions. This video is going to be an instructional video to kind of highlight some of the main points, not necessarily every point, but the main points before you have surgery. First and foremost, be assured that we're going to do everything we can to make your surgery as comfortable as possible. There's a few things that you can do before the surgery to make it an even easier process. The first thing is make sure you understand what the surgery is going to be done. It's totally okay to call the office and say, you know what, I know Dr. K or Dr. Hetner is going to be doing something, but I didn't quite understand. I'd like them to repeat what's going to be done. We'd be more than happy to repeat or schedule another appointment to discuss the surgery and the details with you. The most important thing you want to know is the risks of the surgery as well as the benefits of the surgery. So the risks are always going to be fairly universal. There's always a higher risk of infection. There's always a higher risk of bleeding. There's always a higher risk that even though we did everything correctly for the surgery, you can get some stiffness, soreness, and discomfort. Now, before the surgery, if you have diabetes or any type of sugar problems, you want to make sure your sugars are well controlled. So take the time to go back to your primary care doctor and discuss your sugars. The same thing with your blood pressure or if you have any heart disease. It's really important that a lot of times you're getting all this thing about when to stop medications, when to start medications. In most of our surgeries, you can even continue with your blood thinners up to and through the day of surgery. So if we know that your surgery is going to be more than 30 minutes long, we may have you stop things like Coumadin or aspirin or any other blood thinner that you may take up to 24 to 72 hours before the surgery. Now, it may be confusing, why 24 and why 72? Well, some of us have atrial fibrillation and we have high risks of blood clotting. We certainly don't want you to wait days and days and days without it. So there are alternatives such as heparin or Lovenox. These are injections that we can give you that can work in lieu of the other blood thinners that you're on. So it's really important that you are aware of why you're taking your blood thinners and working with your primary care doctor and with us to make sure that you have the best and safest outcome possible. All these are steps to take before the surgery. Now, a lot of us love to take vitamins and we love to take pills and we like to go to all the vitamin stores and things like that to get the latest and greatest to make us healthier and better. But there are some vitamins and there are over-the-counter supplements that can make our blood thinner. For instance, some of them will actually work with the anesthesia to make the anesthesia last longer. Things like mate or valerian root or St. John's wort. We want to just make sure that we go over those with our primary care doctor before the surgery and also mention them to your doctor as well as mention them to the anesthesiologist, because some of these medications, it's absolutely the best to even stop them up to 2 weeks before the surgery. Another very important thing to help control infection and complications after the surgery and also to get your body ready to heal before the surgery, quit smoking. Now, smoking just doesn't mean tobacco anymore. I know that in Michigan, marijuana and recreational use of marijuana is completely legal, which is great. You have your choice to smoke whatever you'd like to smoke. But the most important thing is to understand that smoke is smoke. What is smoke? Smoke is combustion. Things are burning. So basically, when you burn something, you're releasing carbon dioxide and water. But there's a very evil molecule called carbon monoxide. And carbon monoxide likes to bind your hemoglobin and kick out your oxygen. And if you don't have good oxygen at your bloodstream in the areas where you want to have surgery, your tissues don't heal. Even before the surgery, if you can quit smoking, we know that your lungs actually get about 10 to 20% better before the surgery, and the blood flow to your fingers, especially as a hand surgeon, I'm always working on your fingers, that actually improves and increases. So not only tobacco, but marijuana and also other combustible products. Believe it or not, we have a lot of great diesel mechanics and they're always running those diesel engines. It's really important that before having surgery, try to also minimize your exposure to smoke from your work site. If you're a firefighter or if you just like a campfire every night, all these things are sources of carbon monoxide and increased carbon dioxide, which can knock out oxygen, which is really important to help our tissues to heal. The next thing to kind of be aware of is that you want to also get some of your exercises in, learning some conditioning, because believe it or not, even some of the basic exercises, I know, let's say for instance, your arm is broken and you can't move your arm at all. But if you can move your shoulder and learn exercises with your elbow and learn exercise to move your fingers, the joints before and after the area we're going to fix oftentimes improve the blood flow, decreases the swelling, loosens up the tissue, and really helps the tissues heal. We have experts here that can teach you, as well as if you have a physical therapist that you like to talk to, and the specialists in hand therapy, which are hand therapists and occupational therapists. They're a great resource to learn exercises before the surgery to improve the outcome after surgery. So that's another step that you can do before the surgery to get better. The other thing is to make sure that you have rides and arrangements for you to be able to get to the surgery site, as well as to be able to leave the surgical site. And make sure that everybody's informed, including the person giving you the ride, you yourself knowing what time your surgery is, and please be flexible because sometimes surgery times change, as well as making sure that the doctor's office knows that you need a ride, or that somebody's providing you a ride and taking you home, as well as the hospital. Because sometimes surgeries are canceled if we can't make arrangements for you to have a safe ride to the hospital and a safe ride back home. The most common thing before surgery you hear, and what we're always afraid about, is when do I stop eating before my surgery? Because some people are like, if I don't eat for 4 hours, I'm starving. Of course, no one starves in 4 hours, but it's really important to understand that we don't want anything in your stomach so that if you're asleep, things kind of regurgitate up and then can go down in your lungs. So typically, we don't want you to have any solid foods 8 hours before the surgery. Solid foods are like steak, apples, hard things that you need to chew to swallow. Now, there are things like mashed potatoes and some softer things, and that could be up to 6 hours before the surgery. And then you can have some liquids, just sips of water periodically for up to 2 hours before the surgery. So really important, nothing big, nothing heavy, nothing, meat and potatoes, as we say, nothing solid 8 hours before the surgery. If you have like a little bit of something like a mashed potato or an applesauce or a jello, that you can have that up to 6 hours before the surgery, and you can have sips of water up to 2 hours before the surgery. Now, those are general rules. Of course, some hospitals and some surgical centers have different rules just based on their experience and some of the protocols they've established. So be a little bit flexible, because if we tell you one thing, they tell you something different. Give us a call. We'll help clarify for you. We'll work with you to make your preoperative experience as easy as possible. As you can see, all of these things, from stopping smoking, talking about your medications, when to stop eating, when to do your exercises and therapy before. Also, for instance, when you're going to have a ride home, there and back, all requires communication. So it's really important that when you communicate with us, we'll communicate right with you. We do our best to try to be as informative as possible, but sometimes things slip through the crack, and that's totally okay. As long as you talk to us, we'll talk to you, and we'll make your experience as great, as gentle, as easy as possible to have the best outcome. I wish you the best. I hope you have the most successful surgery possible. If you have any other questions, don't hesitate again to check our website, which is down below, or give us a phone call, which is right above, and we'll be more than happy to communicate with you as quickly, as efficiently as possible. Good luck. I can't wait to see you soon.